Supreme Court Justice Sotomayor. Not exactly very knowledgeable when it comes to her numbers with COVID. So let me just kind of play this. This is an interview with Rochelle Walensky. She's on Fox News with Brett Baer, and he's asking her about Supreme Court Justice Sotomayor's comments. And then it's real interesting. Walensky's deflection in her answer is pretty interesting here. Watch this.
You just heard about the U.S. Supreme Court currently deciding the fate of the president's vaccine mandates. In the questioning, Justice Sonia Sotomayor made this statement.
We have over 100,000 children, which we've never had before, in serious condition, and many on ventilators.
Now, we can find from Friday suggests there are fewer than 3,500 current pediatric hospitalizations from COVID-19. Is that true?
Yeah, but, here's what I can tell you about our pediatric hospitalizations now. First of all, the vast majority of children who are in the hospital are unvaccinated. And for those children who are not eligible for vaccination, we do know that they are most likely to get sick with COVID if their family members aren't vaccinated. So the most important thing we can do for those children to keep them out of the hospital is to vaccinate them and to vaccinate their family members around them.
Understood. But the number is not 100,000. It's roughly 3,500. In hospitals now.
Yes.
He was not taking any of that.
No, he was not. All the spin. Mm-hmm. And then he comes back and he goes, no, the number's not 100,000. It's 3,500. Yes.
Yeah. So I love it. So he says, so it's fewer than 3,500, right? Yeah, but propaganda. And he's like, no.
Right.
It's not 100,000. It's 3,500. Yes. I love it.
So much spin. I wonder, like on the text that morning, it must have said, do not talk about the 100,000 that the Supreme Court justice talked about. Talk about something else. Spin it. Yeah. This could hurt us.
You think about that though. She's using now they're talking about these vaccine mandates at the Supreme Court, and the Supreme Court justice is using information of, there's 100,000 children in hospitals and many on ventilators. No, there's not. There's fewer than 3,500. Where are you getting your numbers from that you're going to rule on these mandates?
97,000 turnaround.
Yeah, you're just a little bit off.
My goodness.
So I'm just going to play. Peter Doocy was asking, Jen Psaki. I can never remember her name because I always want to call her Peppermint Patty. That's what Dan Bongino calls her. I love it. But he really hammers her about this.
You guys have been very aggressive countering COVID misinformation. So what do you guys think about COVID misinformation coming from the Supreme Court and Sonia Sotomayor's false claim that over 100,000 children are in serious condition, many on ventilators?
Well, I'm not going to speak to Supreme Court arguments or statements made in those arguments, but I will tell you that what is at stake here is our effort to protect health workers and, most importantly, protect patients.
Really? Really? Okay. So we're really, really focused on protecting patients. All right. So let's see. I've just got a couple quotes here. So I pulled, these are both from local Fox stations. First one's in Arizona. Quote, a health system operating in Arizona announced a critical staff crisis and updated its guidance to allow COVID-positive health employees to continue working. COVID-positive staff who are improving mildly symptomatic or asymptomatic do not require isolation, but are required to wear N95 masks for up to 10 days of positive symptoms or testing. These measures are supported by the CDC. This is what these people, I'm sorry, that was from California. So they're doing this in California too. Facilities and providers should have asymptomatic COVID-19 positive workers interact only with COVID-19 positive patients to the extent possible. They're telling COVID positive healthcare workers to come to work.
Yeah. So it's not about patient health.
But they're firing all the unvaccinated workers because they could have COVID at some point, but they're telling the people who do have COVID to come to work.
These poor nurses, honestly.
Oh, yeah. It's
week by week.
Mm-hmm. Yeah, not
keeping up with, now I can go to work. Now I can't.
Right.
Like, I can't fathom.
And how about, so you have an unvaccinated nurse. She's fired. Mm-hmm. She's healthy. She doesn't have COVID. She's coming to work. She's busting her butt. And, with the staffing shortages, it's a nightmare out there right now. But She's doing everything she can, and she gets fired. You have a vaccinated nurse, positive with COVID, come on into work. What? And you wonder why people don't believe anything anybody says anymore.
Yeah, because it doesn't make sense. It doesn't make sense. And we're seeing it all across the country, not just these two. I mean, we're seeing it here in Ohio, and we're seeing this narrative that what the government says is correct, no matter what, don't question us. And you saw it there in the CDC. You saw it, everywhere people are talking about the government's reaction to this. It always comes down to don't question it. What are you doing questioning me about what the Supreme Court justice said? Because Jen Psaki, you're on the podium every day lecturing the world about misinformation. And now somebody on your team has misinformation and you don't want to address it. That's why the world is ticked.
Exactly. And it's not just a little bit of misinformation or she was a little off. It was completely wrong. I mean, the complete opposite end of the truth.
Yeah.
And it's just, and of course, and what is the federal employees' response? I don't comment on Supreme Court cases. I bet you we could find some clips where you do.
Yeah.
I bet you.
It's not worth our time, but I'm sure they're out there.
Mm-hmm. Yeah. Speaking of the vaccine mandate being decided upon by the Supreme Court, I was talking to my wife about this, and I said, I honestly don't care what they say. Like, Supreme Court can say, yeah, the mandates are unconstitutional. They come out and say they are constitutional. Keep going. I've never once gone to the Supreme Court for my health checkup or my annual physical. Never once. They don't know who I am. They can't prescribe me medicine. Why would I listen to anything they say about my health? You know what I mean? Like, why are the mandates being decided by the Supreme Court? Like, this is individual personal health,
right?
We're talking about.
But see, your health affects everybody else's health now. I mean, the people in Arizona are worried about your your blood work now. I mean, seriously, like, you could affect them, and it doesn't make sense.
No,
it doesn't make sense.
It never has, and it never will. But I'm hoping that the answers are in the Great Reset. I'm excited to dive into that because we want answers.
They war gamed all this.
Mm-hmm.
So I mean, the World Economic Forum war gamed a mass pandemic in
2019, was it? Right before it happened, right?
Yeah. Oh, of course, right before it happened. And now they're wargaming a total global economic collapse.
That's another thing to keep your eye on. We talked at the top of the show about the new Ebola-like virus in China or whatever, the mumblings about that. But what you're talking about right now is another thing to keep your eye on, this financial situation.
Yeah. So they have war gamed in 2019, in 2021, they war gamed a total economic global collapse. And what would they do to take control when that happened? So they did it about a pandemic, and look what control they've taken globally because of this. And now they've war gamed the economic collapse. I'm not so sure that we don't need to be looking at that pretty closely over the next month or so. And here's the thing, COVID came on the scene quickly.
Mm-hmm.
I mean, it was a quick hitter. I think that the global economic collapse is not going to be a tiered collapse. I think it's going to be a one day you go to bed, the next day you wake up and the banks are empty. Breaking news, yep. Economic collapse. The dollar's worth nothing. The yen is worth nothing. Mm-hmm. We're going to have a whole new global currency. It's going to be tied to blockchain technology. And if you're a white male, you get 1/8 of every dollar that's given to every other person because you're the problem.
Yep. That's a good
If you
point.
read the World Economic Forum, that's
another what it is. It's a good example for the equity.
Yeah.
If you still don't fully understand like what they mean when they say equity. So that's a great example. So that's a lot of talk about the digital dollar.
Yes.
So they could say, okay, you have however many 6 months to convert all your real money, your cash, your US dollars into US digital dollars. And I'm
going to step out on a limb and say that ain't ever going to happen. They're not going to do that. They're going to collapse everything and then reset from zero. Like whatever you have, and this is my own personal opinion, I think that they're not going to give you a chance to convert things. It's just going to be the dollar's worth nothing. Now here's the new global currency, and you get to have some of it, maybe, but you're white and male, and that's probably not going to be much.
You're absolutely right. I mean, and like thinking of socialism, and I know that's really not what we're facing, but I mean, it kind of feels like it. But in socialism, people think, the people that are for it, right, think, oh, these wealthy people, like, I'm poor or I don't have a lot, I want more. You're not going to get more. So what happens is they take the middle class and they detract from the middle class until they reach the level of they're not going to bring anybody from below up. They're taking everybody from above down.
Right.
And you're seeing that in America. So, you go to the grocery store. I know Bare Shelves, is it Bare Shelves Biden?
Mm-hmm.
Empty Shelves Biden is trending on Twitter. I've been taking pictures locally, different grocery stores, all these empty shelves. It's crazy. Every aisle, you go up and down there, massive sections, entire shelves, sometimes entire aisles that are just, there's nothing there. And it's like, I'm pretty sure they're not going to other countries and improving the conditions in other countries to where they don't have empty shelves. No. Now America is going to have empty shelves.
Right. It only makes sense that you only can have two classes of citizens, the ruling elites and all the other people.
And the ruled.
Right. Yeah. The ruling and the ruled. Yes. And so that's what they're going for. But I believe that if they've war gamed it, it's already afoot. Mm-hmm. I mean, Soros has tanked currencies all around the world to upset governments. They could tank every currency in the world. And I'm not in fear, whatever, but I'm just saying that we need to be aware that it's not just a new Ebola or another COVID strain. I think this goes much deeper. It's much darker than what we've seen at this point. We know that just by reading the documents of the World Economic Forum. They want to rule the world. They want to rule the world, and they don't. And America is the only thing standing in the way of the global elites making every decision for everybody on the planet. America is the only one standing in the way. Now, my question is, are we awake enough to know that we're the only ones standing in the way?